Whooping cough, also called pertussis, is a highly contagious bacterial infection of the respiratory system. It mainly affects infants and young children, but teenagers and adults can also get infected. The disease is known for causing severe coughing spells that can make it hard to breathe. In some cases, it can be life-threatening, especially for babies. In this video, we will discuss the causes, symptoms, diagnosis, treatment, and prevention of whooping cough in detail. What is whooping cough? Whooping cough is caused by a bacteria called Bordetella pertussis. This bacteria infects the airways and produces toxins that cause inflammation and swelling. As a result, the airways become narrow, leading to violent coughing fits. The name whooping cough comes from the high-pitched whoop sound that many patients make when they inhale deeply after a coughing spell. Causes of whooping cough. The main cause of whooping cough is infection with the Bordetella pertussis bacteria. This bacteria spreads easily from person to person through respiratory droplets. When an infected person coughs, sneezes, or talks, tiny droplets containing the bacteria are released into the air. If another person inhales these droplets, they can become infected. People who are not vaccinated or whose immunity has weakened over time are at higher risk. Infants are especially vulnerable because their immune systems are not fully developed and they may not have completed their vaccination schedule. How whooping cough spreads? Whooping cough spreads very easily, especially in crowded places such as schools, daycare centers, and homes. A person with whooping cough is most contagious during the early stage, when symptoms look like a common cold. Because of this, many people spread the infection without realizing they are sick. The incubation period, which is the time between exposure and symptoms, is usually 7 to 10 days but can be up to 3 weeks. Stages of whooping cough. Whooping cough develops in 3 main stages. 1. Catarrhal stage, early stage. This stage lasts about 1 to 2 weeks. Symptoms are mild and may include a runny nose, sneezing, mild fever, watery eyes, and a mild cough. At this stage, the disease looks like a common cold, but the person is highly contagious. 2. Paroxysmal stage, severe coughing stage. This stage can last from 2 to 6 weeks or even longer. The cough becomes severe and occurs in sudden, uncontrollable fits. These coughing spells may be followed by a loud whooping sound when breathing in. Patients may vomit, feel exhausted, or have difficulty breathing after coughing. Infants may stop breathing for a few seconds, which is very dangerous. 3. Convalescent stage, recovery stage. In this stage, coughing gradually becomes less severe. Recovery can take several weeks or even months. Although the person starts feeling better, coughing may return if they get another respiratory infection. Symptoms of whooping cough. Symptoms vary by age. In adults and teenagers, symptoms may include long-lasting cough, fatigue, vomiting after coughing, and chest pain. In infants, symptoms can be more serious. They may have difficulty breathing, pauses in breathing, bluish skin color, poor feeding, or extreme tiredness. Infants may not cough loudly, making the disease harder to detect. Complications of whooping cough. Whooping cough can lead to serious complications, especially in babies. These include pneumonia, seizures, brain damage, dehydration, and, in severe cases, death. Adults may experience rib fractures, hernias, or weight loss due to intense coughing. Diagnosis of whooping cough. Doctors diagnose whooping cough based on symptoms, medical history, and laboratory tests. A nasal or a throat swab may be taken to detect the bacteria. Blood tests and chest x-rays may also be used in severe cases to check for complications like pneumonia. Early diagnosis is very important because treatment works best when started in the early stages. Treatment of whooping cough. Whooping cough is treated mainly with antibiotics. Common antibiotics include azithromycin, clarithromycin, or erythromycin. Antibiotics help reduce the severity of the disease and prevent spreading the infection to others. In severe cases, especially for infants, hospitalization may be required. Oxygen therapy for fluids and careful monitoring may be needed. Cough medicines are usually not very effective and are not recommended for young children. Rest, plenty of fluids, and avoiding smoke or irritants are important during recovery. Prevention of whooping cough. Vaccination is the most effective way to prevent whooping cough. The DTaP vaccine is given to infants and young children, while the Tdap booster is recommended for teenagers, adults, and pregnant women. Pregnant women should receive the Tdap vaccine during each pregnancy to protect newborn babies. Good hygiene, such as covering the mouth while coughing and washing hands regularly, also helps reduce the spread. Conclusion: whooping cough is a serious but preventable disease. Early symptoms may seem mild, but the infection can quickly become dangerous, especially for infants. Understanding the causes, symptoms, and treatment options can help in early diagnosis and better outcomes. Vaccination remains the best protection against whooping cough. By staying informed and taking preventive measures, we can protect ourselves and our communities from this disease.